Madam President, 2 weeks ago, the Supreme Court did the right thing and settled once and for all the question of whether the Affordable Care Act is constitutional. As I said on this floor at that 2 weeks ago, the fight is over. The law is constitutional and will stand. Now, some have been saying that this is a great win for the president or for Democrats. I just don't see it that way. I believe this is a great victory for the American people, for small businesses, and for our economy. Now is the time to move past the political distractions and focus on the task before us, implementing the law to bring quality, affordable health coverage to every American. Unfortunately, Madam President, the House of Representatives tomorrow will take a step in exactly the opposite direction. They've cracked open their old, tired playbook and will vote once again to repeal the Affordable Care Act. This is the second time the House has taken this vote to repeal the entire Affordable Care Act, and they have failed every time to pass it in the Senate. The House has also voted 30 times to repeal pieces of the Affordable Care Act, and again, have not been successful on any one of those here in the Senate, in this chamber. And again, if you say, well, there hasn't been a vote, yes. In this chamber, the Senate, last year, every member of the Republican caucus voted to repeal health reform. That failed as well. Madam President, this is just cynical politics. My Republican friends don't expect their bill to repeal the Affordable Care Act to actually become law. They just want to put on grand political theater. Their strategy, dreamed up by the same old cast of characters like Karl Rove, is to gin up the rumor mill, scare people with lies and distortions, while offering no ideas of their own. They don't offer any new ideas because they don't have any. Neither House nor Senate Republicans agree on any plan that controls costs, brings down premiums, or covers as many people as the Affordable Care Act. In fact, a Republican senator was recently asked to describe his plan for the health care system if the Affordable Care Act were repealed. His answer, and I quote, "What we need to do is have a lot of hearings," end quote. That's their plan? What we need to do is have a lot of hearings? Madam President, I don't think that qualifies as a plan. That won't help the millions of people that would lose access to affordable health insurance coverage. Republicans in Congress are pandering to the extreme right wing, those who want to tear down everything that this president has accomplished, regardless of the cost. Their strategy only makes sense if you're absolutely obsessed with two things: tearing down health reform and tearing down this president. Obsessed with that. What would repeal mean for average Americans? Well, I've kind of looked at this a different way. People usually think of the Republicans being against the Affordable Care Act, but I want to just delineate what the Republicans would be for. What they would be for if they were to succeed in repealing the Affordable Care Act. So if you vote to repeal the Affordable Care Act, here's what you're for. You are for putting dollar limits on the insurance coverage of more than 100 million Americans, which would allow insurance companies to stop paying benefits right when you get really, really sick. They just stop paying benefits. That's what you're for if you're for repealing the Affordable Care Act. If you're for repealing the Affordable Care Act, you're for kicking more than 3 million young people off their parents' insurance policy right now. 3 million. If you vote to repeal the Affordable Care Act, you're for allowing insurance companies to cancel people's coverage when they're sickest. Just cancel the policy. You'd be for allowing insurance companies to spend Americans' premium dollars on CEO bonuses, marketing, fancy buildings, rather than on actual health care. How do I say that? Well, because in the Affordable Care Act, we have a medical loss ratio requirement. And because of that, policyholders nationwide this year, by August the 1st, will receive more than $1 billion in rebates from insurers. What that means in the future is that insurance will have to spend at least 80 to 85 cents of every dollar on the premiums that they get on health care, not on advertising, not on corporate jets, not on big CEO salaries, but on health care. So if you vote to repeal the Affordable Care Act, you vote to just let them go back to their old ways. They can spend 50 cents of every premium dollar on health care, and the rest of it they can just spend on high salaries and fancy buildings and conventions in the Cayman Islands and places like that. If you vote to repeal the Affordable Care Act, you're for allowing insurance companies to deny people coverage or to increase their premiums if they have a pre-existing condition. And nearly, close to half of all Americans have some form of a pre-existing condition. So, yeah, I guess that's what you'd be for if you want to vote to repeal the health care bill. Well, if you want to repeal the health care bill, if you vote for that, you're for taking affordable coverage away from more than 30 million people. You're for making insured Americans pay for tens of billions of dollars of uncompensated care when uninsured people show up in the emergency room. This has been estimated to cost American families an average of $1,100 in extra premiums annually. If you vote to repeal the Affordable Care Act, you're for charging as much as $300 in copays for life-saving preventative services that they now get for free, like mammograms, colonoscopies, cancer screenings. More than 85 million people have already used these free services so they can stay healthy, get in charge of their illnesses or something early on when it costs less to cure those diseases. So if you're for repealing the Affordable Care Act, you're for increasing prescription drug costs on seniors by an average of $600 a year. Now that's because in the Affordable Care Act, we close up this donut hole. More than 5.2 million seniors and people with disabilities, I might add, have saved a total of $3.7 billion already on prescription drug spending in this donut hole since we enacted the law. So if you, for repealing the law, you're for making seniors pay more money for their prescription drugs, pure and simple. And if you vote to repeal this, you're voting to deprive states and localities of vital funding to combat chronic diseases like cancer and diabetes and heart disease, ensuring that our kids have access to life-saving vaccines. Now, why do I say that? Because in the health reform bill, there's the Prevention and Public Health Fund, already saving lives, getting money out to communities for these very services right here, cutting health care costs. Well, if you vote to repeal the Affordable Care Act, then you're saying that, well, we're not going to combat chronic diseases like cancer and diabetes and heart disease. Well, Madam President, all of these protections that I just enumerated have been enjoyed by a certain select group of Americans for decades. For decades. Now, what select group of Americans do you suppose I'm talking about that have had these protections for decades? Well, I suggest that every member of Congress, the Senate and the House, look in the mirror. We've enjoyed these for a long time. How many times have we heard in the past when we were debating and having hearings on the Affordable Care Act before we voted on it? How many times have we heard from our constituents, we just need the same kind of health care coverage you guys got in Congress? Well, that's what we did. We had we didn't have higher premiums because of pre-existing conditions, no exclusion because of that. We had no lifetime or annual limits on benefits, no cancellation of coverage when we got sick, no co-pays for vital preventative services. So in health reform, we basically gave the American people the same kind of health care services that we in Congress have enjoyed for a long time. So when a member of Congress votes to repeal the Affordable Care Act, he or she is effectively saying, these consumer protections are great for us, we'll keep them, but they're too good for you. the rest of the American people. You know, that's just the kind of cynicism that takes your breath away. Finally, let me point out that the issue of the mandate issue that has gotten so much publicity lately, well, quite frankly, this issue of this mandate, or as I call it, a free rider penalty, has a long bipartisan history. 7 current Republican senators have previously endorsed a mandate. 7. Many more Republican senators endorsed it, and they're no longer here. They retired or got defeated. Former Massachusetts Governor Mitt Romney included a similar free rider penalty as a centerpiece of Romney Care in Massachusetts. In fact, he said, and I quote, no, I like mandates. Mandates work. Mr. Romney. So we ought to stop these silly political games. The Republicans' obsession with repealing health reform is based strictly on ideology. They oppose the law's crackdown on abuses by health insurance companies. They oppose any serious effort by the federal government to secure health insurance coverage for tens of millions of Americans who currently have no coverage. So it's about really giving control back to their good friends at wealthy, powerful insurance companies so they can raise your rates, hold on to your money by denying you benefits, and making egregious profits. We all remember William Buckley's famous admonition to conservatives. He said that the role of conservatives is, quote, to stand athwart history yelling, stop. William F. Buckley. The role of conservatives is to stand athwart history yelling, stop. Well, in 1935, President Roosevelt and the Congress passed Social Security, providing basic retirement security for every American. Republicans yelled, stop. They fought it bitterly. 75 years later, they're still trying to undo Social Security. In 1965, President Johnson and the Congress passed Medicare, ensuring seniors access to decent health care coverage. Republicans yelled, stop. They fought it bitterly. 45 years later, they're still trying to undo Medicare. Well, here they go again. Here they go again in trying to undo the Affordable Care Act. As I've said before, they are on the wrong side of history. I think we should listen to the American people, leave our ideological obsessions behind. We need to work together to make the law even better. The choice is to go forward or to be dragged backward. It's time to come together as a united American people to create a reformed healthcare system that works not just for the healthy and the wealthy, but for all Americans. Mr. President, I think it's important also to put a human face on this. Let's just put a human face on what this bill really does. Now, I've shown some of these people before. Let's talk about Emily Schlichting. Now, she testified before our committee. She suffers from a rare autoimmune disorder that would make her uninsurable in the old days. But thanks to the Affordable Care Act, as a student, she was able to stay on her parents' policy until she's 26. Here's what she said at our hearing last year. She said, young people are the future of this country, and we are the most affected by reform. We're the generation that is most uninsured. We need the Affordable Care Act because it is literally an investment in the future of this country. Emily Schlichting, student in Omaha. Then there's Sarah Posakani of Cedar Falls, Iowa. She was diagnosed with Crohn's disease when she was 15. During her first year in college, she ran into complications from Crohn's disease, forced her to drop her classes in order to heal after multiple surgeries. Because she was no longer a full-time student, her parents' private health insurance company terminated her coverage, stopped it. 4 years later, after many, many health care interventions, she found herself $180,000 in debt and forced to file for bankruptcy. She was able to complete one semester at Hawkeye Community College, but could not afford to continue. Because of her earlier bankruptcy due to her health, every bank she applied to for student loans turned her down. But now, thanks to the new law, people like Sarah are able to stay on their parents' health insurance plan until they're age 26. So again, are we going to just say to people like Sarah and Emily, tough, you got a bad break, tough luck? Are we going to say that just to make some political point because of some ideological obsession? The Affordable Care Act protects children with pre-existing conditions now. That protection will be expanded to all adults in 2014, just in a couple of years. Well, actually, now that I think about it, in about a year and a half, every adult American will have the coverage, be able to get affordable coverage even though they have a pre-existing condition. Well, that could mean a lot to Eleanor Pierce. She's from Cedar Falls, Iowa. Here's Eleanor Pierce. When her job with a local company was eliminated, she lost her health insurance. She could purchase the COBRA insurance, but it was completely unaffordable to her. So she searched for coverage on the private individual market, but was denied access because of her pre-existing condition of high blood pressure. The only plans that would cover her came with premiums she could never hope to afford without any income. So here's Eleanor, age 62, suffering from high blood pressure, had no choice but to go without insurance and hope for the best. But Mr. President, hope for the best is no substitute for regular medical care. 1 year later, Eleanor Pierce suffered a massive heart attack. When all was said and done, she'd racked up $60,000 in medical debt. So again, are we going to leave people like Eleanor without coverage, with mounting debt and declining health, just to make some political point? These are real people. These are real people that the Affordable Care Act is now helping. They're now helping. Well, Mr. President, as I've said before, the Affordable Care Act is for every American. Many of the benefits that are there now, Republicans would take away by voting to repeal it. And many like Eleanor, who will be helped when it's fully implemented in 2014, will be denied the ability, the wherewithal to have affordable health care coverage so that they can have good preventative health care measures, so they can get to see a doctor and get medical care before they have to go to the emergency room. And yet, tomorrow I'm told that the House of Representatives will once again vote to repeal the Affordable Care Act. Mr. President, and once again, they are on the wrong side of history. It's time to come together. Let's work together now to implement the law. It's constitutional, it's the law. Let's get it implemented. And let's make sure that we don't go down that road again of just political theater, ideological obsessions. I know it's a campaign year. I've been in a lot of campaigns myself. They're tough, I know that. But there comes a point where you got to put politics aside for what's good for the American people. Now is the time to put the politics aside on the Affordable Care Act. Let's get to the business of implementing it. As I said, Governor Romney is the nominee of the Republican Party for president. I'm sure they will do everything they can to elect him. I understand that. That's fine. That's the American way. Wouldn't have it any other way. But just keep in mind, when he was governor, he put in a health care system in Massachusetts that's very much like the Affordable Care Act, with a mandate, and which he himself said, Governor Romney said, No, I like mandates. Mandates work. Well, it's time to move ahead. Let's implement the bill, and let's get over this political theater that the House is going to embark on tomorrow. Mr. President, with that, I yield the floor.